the symptoms of PTSD? Symptoms of PTSD can be grouped into three main headings. First is re-experiencing, and this is the most typical symptom of PTSD. This is where they involuntarily relive the traumatic events through flashbacks, nightmares, repetitive distressing images in their brain. They have these physical sensations like pain, sweating, nausea, feeling trembling or fear. These are the symptoms that we are called in re-experiencing. Another is called avoidance or emotional numbness. Avoidance is where they typically avoid the person, the place that causes them or that will bring up that traumatic event in their mind. They totally avoid that person. They totally avoid discussing about that traumatic event. They kind of totally push that traumatic event out of their brain. This is called emotional numbness, where they feel nothing about the memory. They try to push it out of their mind. It's called emotional numbness. Another one is, by that, they can start isolating themselves, start feeling withdrawn. That's the typical symptom you might see. Another group is called hypervigilance or hyperarousal. In hypervigilance or hyperarousal, they are too anxious, they're so worried, they're easily startled. You see them feeling irritated, having anger outbursts. You see them having difficulty concentrating, having insomnia. Even in children, these typical signs can also be seen in children, where they feel, having this difficulty to sleep, where they feel having nightmares. The children can also try to reenact the traumatic event through play. These are the classical symptoms of PTSD. Thank you.